Hi, Matt. I'm so glad that you could take the time out of your busy schedule to talk to my group members and I about the diabetes and exercise. So, before we get into that topic, could you just describe a little bit about yourself and run us through your qualifications that you have when dealing with this population?
I'm sure. So it's a pleasure. Yeah, it's no problem. Thanks for having me. Um, a little bit about myself. My background is in kinesiology. So I just finished an undergrad from Ontario Tech University in kinesiology, and I am certified as a CSEP, certified personal trainer. So those are the qualifications that I have that allow me to sometimes deal with people that suffer from these conditions.
All right. Thank you for sharing. To start off this little interview here, I think it's important to make note of the physiological changes and the anatomical changes that are associated with diabetes. If you could give us a little insight on that, that would be great. Please and thank you.
Sure, sure. So diabetes itself is a metabolic condition. So it's a disorder where the body's pancreas, specifically the beta cells, have trouble secreting insulin, or maybe have secreted too much insulin to the point where they've essentially failed or they can't make as much. And the body is just not sensitive to insulin anymore. So that basically leads to sugar in the blood becoming elevated. And so that basically poses a lot of risks as it can damage cells and whatnot if it's not treated over time. So, with people with type 2 diabetes, supervised exercise programs have been particularly effective in improving glycemic control. So, in terms of changes that occur with exercise, they tend to reduce their medication intake. So, they're not using as much anymore if they're exercising. Um, they're also using less insulin as well. And if they have a lot of weight loss as well, that comes with exercising and, of course, coupled with like a proper diet, that can also lead to a lot of changes as well. So if you want, I'll go over some of the physiological changes if you want, just to kind of explain how, like, what exactly happens if you'd like.
Yeah, please and thank you. I'd appreciate that.
Sure. So the primary change is that the body is able to essentially dispose of blood sugar more efficiently. So as they become more accustomed to exercise, their muscles are able to utilize more of circulating blood sugar. And also, the increase in lean body mass, so muscle tissue, develops a larger reservoir for glucose deposition. So basically, if you have more muscle mass, you have a bigger sink essentially to hold on to glucose, and so you can utilize that for another time you're exercising, and it reduces the chance of hypoglycemia in the future. And typically, like I said, if they're consistent with a good diet and they reduce body fat, and specifically visceral body fat, so the fat around the organs, and that's the fat typically that basically makes diabetes worse, as fat around the pancreas, for example.
Right.
Right, right. The fat around the pancreas is what can pretty much impair the beta cells, and it can't secrete insulin as efficiently or can't secrete enough. And so you losing that fat is really good for them as well. It basically allows their disease to kind of, get better. And I use a waist to height ratio, which is a good way for me to deal with that. So typically, I try to see what the client's waist to height ratio is, and then from there, I would see if they have lost visceral body fat. Because of course, I can't find that out. They would have to go get like tested.
Yeah, an exam.
Yep.
Well, that's interesting. We did learn a lot about the dangers of visceral fat in school. So it's nice to hear someone bring that up. I guess we'll move on to the next question, and that'll just be what are some indications and contraindications that you may face when planning exercise with this population of diabetics?
Okay. Yeah. Sure. So indications. I guess the two big things are if someone were to go hypoglycemic, so if their blood sugar were to essentially crash, or if I had a client who had like late stage diabetes, like neuropathy, where the blood sugar is so high that it leads to like numbness and tingling, so damage to nerve endings. So those are the clients I tend to be a little bit wary of, and I just follow the basic guidelines. So typically, these clients have spoke to a physician or either an exercise physiologist, and so they essentially know their risks. They know everything. Everything's gone through informed consent, and I explain everything. So they're well informed about the things they have to do and take care of during, after, before e- um, exercise. But also, I have to be on top of that as well. So, for example, if I needed someone to do a 30 to 60-minute moderate to, you know, I guess low to moderate intensity exercise, I would ask them to have at least maybe 15 to 40 grams of carbohydrates beforehand to make sure they're not hypoglycemic. I'll just ask if they have had it because typically their doctor may have already told them to eat something before they go in for an exercise. Um, Another thing is varying the exercises is something I do. So making sure that they do the exercise and they pretty much rest as much as they need before making do something else. So that will basically allow sugar to be regulated a little bit more better than if I were to just completely gas them out, right?
Right.
Yeah. And then, like I said, the late stage disease. So if one were to have neuropathy, that's the biggest. So I would not let them do any sort of jumping up and down, plyometric style, like any rapid directional exercises like agility training, because those kind of individuals, they deal with a lot of numbness and tingling and a lot of pain in the peripheral, like and it can lead to exacerbation. And I also keep an eye on their dehydration as well, and if they're overheated, and I just kind of pay attention to them. So it's really important to just make sure you're communicating with your clients, and you'll be okay for the most part.
Awesome. Thank you. That's some good information. Yeah, it's awesome. So, I guess moving on, that kind of led us into the next question again. So then what are the current best practices that you use in
Mhm.
your approach to training people who suffer from diabetes? So,
Okay. Yeah. So, so the recommendations are pretty much the same. So they need to get at least 150 minutes per week of aerobic exercise paired with at least 2 sessions a week of resistance training. But I kind of tweak it a little bit. I give them 3 sessions of resistance training and like a little bit less cardiovascular, only because the literature shows that resistance training is a little bit better for their condition.
Right.
And so, when it comes to cardio, so aerobic exercise, walking, bicycling, right? Like cycling,
Mhm.
swimming, jogging, anything that like involves rhythmic movements, using large muscle groups is really good, right? So that can basically allow them to utilize more blood sugar and allow them to become a little more insulin sensitive. Resistance training is really good as well. So anything that with weights, like weight machines, resistance bands, or their own body weight, right? Depending on how I progress them throughout their exercise prescription. And that's good
Mhm.
because they build strength and endurance. And it's also important to have a little bit of flexibility and training and making sure that they do some static stretching to increase their range of motion.
Right.
Right. So that type of stuff's important just so it makes exercise enjoyable because a lot of
Mhm.
people, it's the mobility aspect that kind of scares them from exercising. Like that's what I tend to see a lot. Um, and overall, another thing I'd probably mention is just reducing sedentary behavior. So something I always try to ask them is try to have like a walking monitor, like your phone will count your steps for the day. I try to ask them to get at least 5,000 steps a day. Just anything to like they usually reach that just from work alone, but at least having that because there are days where they're off and just they'll be more sedentary than usual. So just being able and having the time to get up and move around more
Right.
throughout the day is good because that there is like a link between sedentary behavior and insulin sensitivity, and it can lead to resistance, and it can actually make the diabetes worse over time if you're still sedentary and are also exercising.
Okay. So then I just have one more question about that, I guess. I have heard through my own research that people who suffer from diabetes often have a lot of heart problems accompanied with that. So I heard that it was very beneficial to train your cardiovascular health as well to kind of
Yeah.
benefit that. But again, I think it's also cool that you noted that the training protocols for someone with diabetes isn't too different from the general population, as opposed to if you had another special population, like maybe Alzheimer's or something,
Hmm.
or even I don't know, Parkinson's. It's cool that you said that you do base your programming off of like getting the recommended minutes, and then you just try to improve their biomarkers, but the exercise programming isn't that limited. So
Hmm.
it's cool that you did note that.
Hmm.
And then, yeah, that'll lead us again to our next question. And I just want to ask you, what are some challenges that you face when developing and implementing health promotion strategies that encourage healthy lifestyles for people with diabetes?
Mm. Okay, so yeah, there is enough like scalable evidence on like exercise for preventing and managing diabetes, and it's sustainable, but it's the sustainability like that's tough, right? So patients, or or I should probably say clients, are it's very hard to make sure that they're consistent with the exercise prescription, right? Like that's probably the hardest part
Mhm.
of everything. You probably get that too, like maybe understanding like clientele and just the training life.
Yeah.
Right. So I think education and guidance is the most important thing, like being able to share this information with them, because a lot of the clients that I knew, they didn't know that resistance training can give them such a benefit to their blood sugar levels and all this stuff. And sometimes even their family doctor doesn't even know that stuff. So just being a master of your craft is a good way to make sure that they're being more adherent to their exercise prescription. So that's what I face. It's a lot of time management issues. So usually people will say I have time is a really big barrier, and that's true for a lot of people, right? People have very
Mhm.
responsibilities, different lives. So it's good to get them started slowly, and then because it's better than nothing at all. Even if you get them in the gym
Right.
twice a week, that's like a snowball effect over time. If you just kind of slowly just keep talking to them and get them moving, and they'll eventually start to like exercise as you introduce exercises that they enjoy. So it's a little bit of trial and error.
Oh, you're breaking out.
Oh, can you still hear me?
I can hear you.
Okay. So where did I leave off? Did I get cut off?
No, well, yeah, you got cut off. But I think you did answer my question. I just want to ask you maybe one more
I was gonna
challenge
just
that you
add
may
one
face
more thing.
potentially.
I was just gonna add one more thing
Go ahead. Go
about the
ahead.
challenges. Yeah, the challenges. One thing is the nutrition as well. So
I was
we,
just gonna ask you about that.
okay, good. So me and we both know our scope of practice is gonna be limited to essentially exercise prescription, and a lot of times depend, even if you have like a chronic condition and the benefits are surreal through the research, it's very difficult to get a lot of those benefits if you have a poor diet, right?
Right.
So I always do suggest the Canada's Food Guide and basic research articles that highlight like better nutrition strategies for those who suffer from diabetes, and I ask clients to go to a dietitian or a family doctor to pretty much discuss that information just so they get the best care possible, because the exercise alone won't do anything, and you don't want a client to basically just blame that it's your training that's not doing anything for them, because there are other factors, right, that they are
Yeah.
aware of. And so it's good to just be open and uh, just educate your clients and communicate with them.
Yeah. That's very good advice. And yeah, thank you. So, before we end off, I just have one more question. You don't have to go too in depth about this. I just want to get another perspective from a fitness professional, and maybe see how they plan a workout for someone in this population. So, on a given day, if you were training one of your clients who has diabetes, what would you normally run them through if you only had about 45 minutes? What are the most important things that you would make sure that you included in your workout? Or maybe just some tips that you'd like to give me if
Mhm.
I ever ran into more of people within this population in the future. What can I take from it and maybe try to implement in my programming?
Sure. So just typical workout outline, right? Like just
Yeah,
okay.
yeah,
Um,
very brief.
so yeah, so the workouts, like we just discussed before, right? Like the exercises aren't very different at all. Like they still have the
Mhm.
same guidelines: 150 minutes of aerobic, about 2 to 3 sessions of resistance training. So I would usually start with a form of dynamic, like warm up, like some sort of aerobic and dynamic warm up to get them going. So this can be like 2 rounds of like jumping jacks, jogging back and forth on a track or of some sort, walkouts, push ups, light rows, rowing maybe. And so this is about 5 minutes just to kind of make sure that they're warm and I'm warming up the muscles that they're going to be using that day. If it
Okay.
is Yeah, so if it's like a cardio day, I usually like this mix steady state cardio with high intensity interval training, but that's dependent
Great.
on the client's tolerance and experience, obviously. There are some individuals who can do it and are
Mhm.
fine. And there are some obviously that you're gonna have to cater towards and adjust exercises. But this could be running, rowing, or cycling, and it's pretty much about 60 to 75% of their heart rate max. So I like to have a heart rate monitor on them, just so it gives me a little bit more of like, like continuous like feedback just throughout their exercise, so I know where they're at, and just because I want to know if they're pushing themselves really, right? Um,
Right.
and yeah, so I just adjust the intensity from there, and I would also do some tabatas, like I said, if they wanted to do some hit style training, and the exercises would basically be based on their tolerance and what they can do, and I would progress and regress with any exercise that they can and can't do.
Right.
Resistance training is the best part to me because that's what gives them the most benefit, and I hear a lot of benefits. So I've had clients tell me like the weights do wonders for them. So resistance training is usually 6 to 8 exercises during a given day, and I emphasize compound exercises, and I'm sure you know what those are. Those that
Yeah.
use multiple muscle groups, because if you're going to utilize multiple muscle groups, you'll be able to build lean body mass all around, and that's going to basically, just add on to those physiological benefits we discussed earlier. So the goal is essentially to build as much all-around lean body mass, reduce body fat throughout the training cycle. Then I end off with static stretching, which is basically just stretching out the muscles that worked for that day, right? I basically hold each stretch for around 30 seconds and I do 2 sets of that. So 2 rounds, just so they have some flexibility and a little bit of training for their hips and low back stretches so they don't have a lot of back pain or tension when they get home. So yeah, that's typically how an overall outline would look like. Yep. Hello?
Okay, you broke out. That was our last question. I do want to make sure that we end this maybe before we lose everything. So I really thank you for coming out and again taking the time to discuss this with me. You've given us some very great information that we can use in the future and present to the rest of our classmates. So I really thank you for your time. It's been awesome speaking with you on this topic. And yeah, Is it okay if I give your contact information out to my classmates and on my written report?
Yeah,
Do I
yeah.
have your permission for that?
Mhm.
Awesome. Thank you.
All right, no problem. All right, take care.
All right. Take care. Thank you, Namat.
No problem. Have a great day.
You too. Bye.
Bye.